Detecting liver diseases in children. Introduction. It is a known fact that children cannot be treated as mini adults. They have a wide spectrum of liver diseases in comparison to adults. Hence, the detection and treatment options are different from adults. On the other hand, metabolic diseases are an important component due to genetic and etiological factors. But one of the major problems in detecting pediatric liver diseases is the unavailability of diagnostic modalities and/or higher cost if present. Another problem often overlooked is the difficulty in recognizing the early symptoms, which often manifest as poor growth. On the other hand, before moving on to the clinical symptoms, there are certain factors of liver profile in children that should be taken into consideration, such as conjugated bilirubin greater than 20% of total serum bilirubin. In the pubertal age, the alkaline phosphatase levels are higher in comparison to other age groups. Neonates have a lower albumin level. GGT should be considered a part of the liver profile. Also, Palmer erythema is a common clinical manifestation that is often seen in many children without the disease condition. Clinical characterization. Since many of the clinical features of chronic liver disease are related to the failure of the liver to carry out its normal functions, we will be discussing them in this video, such as jaundice or icterus, a yellow discoloration of the skin and whites of the eyes that usually occurs when serum bilirubin is greater than 50 micromole per liter. Portal hypertension, increased pressure within the portal venous system as a result of increased resistance to flow through the damaged liver. Collateral veins develop, and these can bleed due to the increased flow and pressure within. Splenomegaly, caused by increased pressure in the portal venous system and indicates portal hypertension secondary to cirrhosis. Varices. Esophageal and gastric varices are abnormally dilated collateral vessels in the esophagus or stomach, which arise due to portal hypertension or obstruction. These varices enable blood to bypass the liver as a means of reducing the portal pressure or bypassing the obstruction. If the pressure in the vessels becomes too high, they can burst, leading to massive hemorrhage. However, if the issues associated with the liver get worse, some of the other signs and symptoms of liver disease can be seen, such as itching all over the body, swollen abdomen from fluid buildup, ascites, dark urine, easy bruising or bleeding for a long time. Issues related to the brain, such as unusual sleepiness during the day or sleeplessness at night, encephalopathy, confusion and irritation all the time. Detection factors. It is difficult to determine or diagnose liver-related issues in the early stages. The symptoms are like other issues, so the doctors perform many specific tests to diagnose the actual illness. If the symptoms are clear, the patients are asked to check for high liver enzyme levels, signs of encephalopathy, also known as brain damage, high bilirubin levels that lead to jaundice, issues with blood clotting. Conclusion. Hence, the bottom line is that liver diseases in children are manageable if identified at the initial stages. However, if not treated on time, they can permanently damage the liver and affect its functioning. In addition, untreated or unmanaged liver disease complications can lead to cirrhosis and severe scarring that cannot be reversed. If cirrhosis goes too far, the child may need to undergo a liver transplant. Some liver diseases can develop without any signs or symptoms. Thus, parents should take their children for annual checkups. In addition, there should be a focus on a nutritious diet, physical exercise, and other healthy lifestyle choices, such as limiting junk foods, being more engaged in sports, and much more.